Okay, so this is the final part of the agenda, really. It's the Q&A session. So there's no more formal presentations, but what we're going to do is open up the Menti, because that is where we have been asking everyone to input their questions. If you cannot access Menti, not to worry, we will also take questions in through the chat or through your raised hand here in Microsoft Teams. I'm going to have Raquel Shaw-Moxham and Corrine, who've already spoken today. They'll join on camera right now. They will be answering the questions today. So we'll turn it over to Menti, please. Thank you, Kate. Okay, so this is just in the order in which we received the questions. So the first question here is, Farah, thank you for your land acknowledgement. Would you please provide a list of the books that you noted? I am familiar with some, but not all. So I believe we in the background have scrounged the list, but Farah, please feel free to.
Yeah, no, I was just going to say Kate had reached out in the background and I provided her with a list. So I'm sure that can be provided in the chat or through email or whatever, but they're all there.
Thank you so much, Farah. So we will provide that list in the chat, and there you go. There it is. Okay, great. Thank you.
You're on mute, Kristen.
Sorry, next question, please. Thank you. Okay, I think this is probably a comment. Another good book is 21 Things You May Not Know About the Indian Act by Bob Joseph. Eye-opening. Thank you. Next, please. Okay, gathering what patients current and recent needed during diagnosis, treatment, and transition out of active treatment through a needs assessment project would fit this work. From the assessment, develop solutions.
Yeah, sure. Can I chime in there? So I think our question is asking about the fit of a project idea, which is great. I love that. And these are the type of encouraging things to hear from partners where you're at in this stage. Would gathering what people need during their cancer care journey through a needs assessment fit. I think it's an early stage. I think where the partnership is hoping some of the work would be is in the implementation of the solution, but I think a needs assessment is absolutely appropriate. It would be part of that engaging those that might be at the forefront, underserviced with unique needs. Maybe there's some data to inform that needs aren't being met. I believe that this is the first step in doing that. So I would actually, the person who's asked this question, I think I'm gathering from the latter part of this question here is about and developing solutions. I would say yes. And if there was time based on where you think you are in the jurisdictions to be implementing a part of that solution based on the information gathered from the needs, this absolutely meets the needs of what we are aiming for. Again, I think we also want to showcase also some evaluation of what you are implementing, because I think that's the data that's important to a region or jurisdiction to know what's working, what's not working, how to make improvements, etc. So good early thinking. And if you haven't already, feel free to fill out a planning survey in partnership with those from your jurisdiction and think through that a little further. And we're, like Cheryl said, we're here to walk that journey with you. Anything else to add, Raquel?
Other thing I can add is that definitely we would encourage you to complete the planning survey that's due on June 13th and to put this in as the first step to developing your idea. And that this is where we would have consultations with you after to gather some more information. And then there is planning money to kind of support this early phase of, idea development.
Thank you both. Okay, next question, please. To better design models of care and treatment, we need to assess current staff model, role responsibilities to determine what can be leveraged to create new models of care, and to expand role or staff model to support.
Jump in here. I think this is a great comment. Understanding the current state and future desired state. Also, we talked about it a little bit in the kind of context of how some of this work came to be, and the Models of Care Toolkit really does showcase a couple of specific examples to optimize scope of practice in different roles. And I think that's absolutely related to this comment about what staff are there? Are they working to the full scope of their practice, or maybe more specifically? And of course, there's many challenges previously, but that were exacerbated by the pandemic with health human resource challenges, and many healthcare systems, hospitals, clinics, etc., are not able to hire more people. So hiring more people is likely not a solution in many instances. So how can we utilize what we have and make the most efficient use of those? So great comment. If any others wanted to chime in or add something, please do.
Okay, thank you. We'll move on to the next, please. Is there any information available from the transition study specific to Indigenous communities that would be of any help?
I can
Raquel,
jump
how do you
in.
feel
Yeah, I'll
about
jump in.
starting there?
Yeah. I can jump in. I was part of the transition study team. I don't believe that we had this demographic question within the transition study data. However, you could definitely check on, I know the transition study, that we do have a link to our website to get some information regarding the transition study and to look at the questionnaire. But I don't recall this being a demographic question, so I would say no. But yeah, but definitely we do have the information on transition study, and the questionnaire is available there to look a bit deeper into this question.
Thanks, Raquel. I also might add, I appreciate that people are looking for, information that might be existing in data in some ways, and just because it might not have been collected in transitions, but there could be other pockets of data within your jurisdiction, region, healthcare setting, etc., that could help inform if you're thinking about an area in follow-up care and survivorship.
Cheryl?
Cheryl, I think you have your hand up as well.
Yeah, I was going to follow up on Raquel's point that indigeneity was not asked. It was not one of the questions on the transition study.
Thank you, everyone. Okay, great. Next question, please. Can you give examples of groups that are considered underserved? Allophone groups and patients without family doctors are good examples.
Kristen, you provided a great list of examples up earlier on. Do you want to repeat that for us here? And then we can maybe add on.
Sure. And just for reference too, in the FAQ document, we do provide a table, an exhaustive list, and I just pointed out a few in my presentation today, but it's not a full inclusive list. So for reference, the FAQ would be a more fulsome list. But just for some examples of equity deserving communities and populations may include people living on low income, recent immigrants, refugees, sexual and gender minorities, cultural groups, people living in rural, remote communities, may also be people with, physical disabilities or comorbidities, and for sure, people living or experiencing food or housing insecurity as well, just to name a few. So those are some of the groups. But again, the FAQ, which we can put the link in the chat as well, just for reference, has a full list. I don't know if anyone else wants to add. Cheryl, please go ahead.
Yeah, I would say that patients without family doctors are definitely an underserved group as well. If you
Thank you,
consider
Cheryl.
groups that are not receiving the same level of care, whose outcomes are poorer, whose experience is poorer, who you can see that your system is not set up to serve the same way it is set up to serve others, then that's a good example of the groups that are underserved within your jurisdiction.
Thank you. Okay, next question, please. Okay, so I'll turn it over to the group. Please feel free to raise your hand, and we're happy to answer any questions. And any questions that were asked today that aren't currently in FAQ, we will be drafting responses to and posting an updated version on that online partner space.
And thank you to those who left your questions in the Menti. These were fantastic. Always good to know what's burbling up and perking your interest. Do we have any coming through the chat? Not that I see.
Nothing through the chat. And the next item, there aren't any questions. We can give everyone another minute or so. I'll be turning it over to Raquel to talk about next steps and closing remarks.